We're going to introduce our next panel discussion, the consumerization of healthcare, which is a great segue from the public discussion we just had. We'll have three guests today. We have Vuong. He's the co-founder and chief commercial officer of thuocsi.vn. Vu, please make your way to the stage. We have Raghu, the founder and CEO of GeoHealth. And lastly, we have Minh, the category lead of hospital BU of Pfizer.
So excited to have all of you and to share your stories. Miss Minh, with your 10 plus years at Sanofi and now at Pfizer, running the hospital category. Raghu, hearing your story about building what I guess would be called a full stack healthcare business. And Vu, hearing your story of defragmenting Vietnam's pharmacy industry. So thank you, and can I have another round of applause for our panelists? So maybe I can invite you, Ms. Minh, can you share with us a brief background on yourself and what your focus is today at Pfizer?
So first of all, thanks a lot, everyone, for having me here today. So I'm Minh, and I'm just, in a nutshell, I also from the university that you just have the Dr. Thuong here present about. So I'm really glad to hear, and to see the improvement after years. The reason I feel proud because I have my all three, the family of three generations in pharmacy and doctor and graduate in Vietnam. One from the north and a few in the south from this university. And my experience at that time and coming to the same university of my parents is that, Mom, did you know the machine that we do the lab today at school? And then Mom say, you still have that with you? So in my age, like early 20s. So at that time, I just felt, and I also asked, the people around and my family. I understand that we have a lot of change outside. But at that time, at the university, a lot of legacy stay. And with that, and with the family, I see, a very, let's say, a proud time working in the industry, especially through last 2 years, to bring a lot of, I think, value to the people around us, around our family. Not only about customer, patient, but at least we also have, a lot of good advice to join in hand during our last 2 years here in Vietnam. And from my side, so I start with Sanofi, I think, fresh graduated. I grow with my first love, and they grow me off. And since upon a time, I also been thrown to Cambodia. The first, let's say, exported case to do the GM role in another country. And after that, I was re-imported back to Vietnam and working on the retail channel. So that's why I have a big passion to see the quality on the activity to improve that access to the patient. And moving to Pfizer, actually, I also try another way to develop myself. So I try to take into the categories that I was not do anything before, which is vaccine and oncology. And with that, after 2 years now, I think it gained me a lot of insight. I'm confident also to move to another, let's say, portfolio in charge, which is the hospital BU portfolio, which stands for the most, let's say, popular thing that we face now in Vietnam, anti-infection, antifungal, or let's say primary care that we are talking about, and also the retail channel. So with that, I'm here today, happy to know the people really, make a lot of impacts in the last 2 years in that channel.
Thanks, Minh. That's a great story and segue. Raghu, could you share with us your vision on GeoHealth and a little bit of the founding story?
So really nice to be with everybody. Happy Thanksgiving. I'm the founder and CEO of GeoHealth. We actually started our journey back in Southern California. At the time, we were just purely a technology company, and our job was really to help provide clinical workflow solutions for HMOs and healthcare delivery organizations in really jump-starting remote chronic disease management. And it was really kind of serendipitous. One of our angel investors had encouraged us to look at Vietnam as really a destination for some offshore software development. So we didn't have any aspirations to enter this market. It was a totally unfamiliar geography for us. Over the years, we were visiting the market 2 to 3 times a year, and we were quite frankly facing some challenges with our business model in the US. And so on one of my trips, I had the curiosity to take a look at some of the local hospitals and clinics. Some of the opportunities that we saw were, there was no digital infrastructure at the time, a very fragmented customer journey. And so in early 2018, we decided to survey a few of the markets around the Southeast Asia region. We looked at the Philippines, Singapore, Malaysia, Thailand, India, and we felt that Vietnam would be a great place for us to plant our seeds, not only because of the macro demographics, but also because it has a really high out-of-pocket spending. So the consumer is somewhat sensitized towards paying for their healthcare. There were some obvious challenges in terms of the technology that needed to be provided to upgrade the care experience. But we also felt that not only could we be a technology platform, but we could potentially undertake the enormous task of becoming a care provider. And so we entered the market in 2018. We built what we consider to be a consumer-centric ecosystem. There are omni-channel capabilities to that. So we have virtual care, we have home-based care. We do have outpatient facility-based care. We do partner with both public and private hospitals to coordinate care. So we view this as being a very mutual collaboration with other stakeholders in the industry.
Thank you for sharing that. And Vu, you're also second generation industry. So would love to hear how you and your co-founders have come to defragment the pharmaceutical industry.
Thank you for having me. I want to say sorry for my limited English first. I try to speak slowly using simple words. My name is Vu. I was raised in a family that everyone doing pharmaceutical in central Vietnam. Growing up, I see a lot of inefficiency in the way we distribute drug. And I wanted to make a drug accessible and affordable to every patient in Vietnam. And when I come back to Vietnam 5 years ago, I opened my own distribution company. And I found out a lot of drug I cannot distribute because it's very low margin, price very low. So we thought e-commerce is the way to stop that. And we founded thuocsi with my 2 co-founders. And currently we sell about 20,000 pharmacies in rural Vietnam. We currently, I think, solve the accessibility part of the problem. Right now, a pharmacy can get access to a wide variety of products that we provide, but we had not necessarily solved the affordability problem. So even we sell cheap to the pharmacy, it's not necessarily that they will sell cheap to the patient. So I see a lot of things that need to be done. And
So you're laughing because I know that you probably battled on pricing for margin. And I mean, the reality is private healthcare, particularly in pharmacy, was relatively nascent 5 years ago. And I supported the Pharma City guys, and I remember our margins were quite low because we couldn't get great pricing. But we were also a really small blip on the channel. Everything was mostly public healthcare. So perhaps we come to you, Minh. What have you seen as the biggest change in kind of the consumerization of healthcare, and has there been a shift from the public sector into the private sector?
Well, I think per my experience here, I think last over 10 years. Well, when I come back, first of all, I hear a lot of, like pop-up of chain. So at that time, Pharma City was a well-known name to work with. However, at that time, we also evaluate, the segment, the fragmentation status of the market. And overall nationwide, we know that for retail channel, we have around 40,000 outlets where the patient can come and get medicines across all the Vietnam, 64 provinces. And at that time, the chain was not, popular enough for the patient to get access. and no telehealth, like e-commerce at all. Over, I think, last 2 years, we also, at that time, we think that we have a lot of reimbursement coverage increase. And we saw the trend, especially for chronic disease, the patient come back to the hospital to ensure that they can cover their health expense a little bit. And that's why, in terms of, let's say, forecasting 5 years ago, if you ask me, when I do my business case, I bet more on hospital channel, especially public channel, when we see the patient flow increase naturally. However, especially after, during COVID and after COVID, during the lockdown and up to now, I see also patients have, some reluctance to really come to the hospital if it's not a severe condition. So it back a little bit to the nature that I have seen in 20 years ago when I was in pharmacies of my mom, that patient come and ask for recommendation or to renew their prescription. So, and then when I check a little bit of data here and there, I also see, not only me who's seeing that, but I saw also from the chain perspective, we see not, the patient come from, instead of an independent to the retail, but overall, we see the trend that for the retail channel, currently, we see a higher growth. And also, I expect that for at least, I think, next 2 or 3 years, because also they also have higher demand for, let's say, tele or auto medication for themselves for what?
Thank you for that. Raghu, so have you been a beneficiary of that shift? Have you seen an uptick? And what's been a driver of that?
Well, I think that we feel that the consumer is going to be an increasingly important, if not central, stakeholder within the industry. And so our value proposition has always been kind of built around 2 to 3 key things. One was having a one-stop shop, so full spectrum care, over 14 specialties of care that we can provide, which really gives consumers an end-to-end cohesive experience. Number 2 is, of course, affordability. And so we definitely need to benchmark ourselves with other industry players just to make sure that we have transparent pricing, that we have an expectation that consumers will not be overcharged when they do come into our ecosystem. And then the third thing is that there needs to be some convenience in terms of the form factor. And so there are mediums of care like digital, which are not self-sufficient. I don't think, for instance, that telemedicine is really like a panacea for this industry. I think it's a supplemental branch or medium of care that could support other aspects of that care journey. And so for us, as long as we continue to maintain that customer centricity as a company, consumers are going to discover more sophisticated preferences. We're not trying to boil the ocean either. I think that there's 100 million people in this market. It's not a zero-sum market. The public sector plays a very important role in that. I think the private sector is still really insignificant. And there's going to be capabilities that we cannot deliver that only the public sector with its resources and legacy can deliver. So I don't even think that there's a migration yet from public to private. I think we're at the very inception of that. And all of the work, I guess, that the private sector is doing is hopefully going to encourage a balance between the two.
That's interesting. Really insignificant. And Vu, your business is not insignificant. You guys have grown your business quite significantly. You now distribute to 17,000 pharmacies across
20,000.
20,000. My stats are always wrong here. So 20,000 pharmacies across the country. How has your business grown, and did you see more demand coming out of your pharmacies and clinics that you distribute to pre-post-COVID?
Well, I can answer that, but can I add to the last question?
Absolutely.
Because moving from public to private. So in the province, public usually means hospital and private pharmacies. So I see a movement like very big, like our data show that, but not because the patient want to, it's because they have to. Prescription drug in the hospital is not available. And patient want, in the province, they want to go to hospital to get paid by social insurance. But because the drug is not available, they have to go to the private sector. And we see a lot of increase in March. Until July, I think we have hospital drug that's increased like 10 times in the private sector. And right now it's normalized as about 4 times to the regular rate. So I see a lot movement, but I don't think it could call a patient want to, because they have to pay out their own pocket. Can you ask again your second question?
I now want to ask another more nuanced question, which is about pay. So, Vietnam still has pretty high out-of-pocket pay. And so what you're experiencing is demand in the rural areas is about availability. Could you guys address pay? And it seems like, Minh, this might be a question for you, is what is, out-of-pocket pay and social insurance reimbursement a driver for demand in the system?
Well, so I think, we have a quite diversified portfolio, and then the pain point is quite different for each portfolio. So if, we ask ourselves about the access for the very severe, the ICU patient, I don't see yet, a pathway to help for, let's say, the affordability, except some program and the policy we have for the patient support program to help the patient there, but still in the, let's say, the reimbursement system overall. But the point that we see so far, I think it has a legacy here. The pharmacy channel is 100% out pocket, okay? And this is, it's also linked with the availability in province that we'll just share here, that we see some movement. And I see for my side 2 parts. One is the willingness to care more about themselves. And then actually now, I also face the problem of Dr. Google. People also, save their time with all the telethink, and they try to figure out their symptom and their problem. They come to the pharmacy first. If it's not so severe, to come to see the doctor. And then after that, if they really have, wealthy to pay, then pharmacy is quite affordable access for them as a primary care. Sometimes I can tell you, I just evaluate or I assess a pharmacy seller is kind of a doctor for some, some consultants that I saw. And then come back to the story of like for the product they have. So at the pharmacy, we have everything. And with Pfizer as a like brand company, we come with brand. But of course, we have some product. We know that it's still affordable for the patient with, effectiveness. So efficacy go with the cost. But we always face as well the problem about affordability when the patient just get the generic, the cheap. I'm not saying that they are cheap wrongly, but sometimes it cannot demonstrate the efficacy that they need to be treated. So for us, it's also a concern, and we do a lot of, I think, let's say review whenever it comes to a new launch to ensure that we really think about affordability for patient whenever we give another, new medicine, innovative medicine to the market. But it's hard for that part.
Thank you, Minh. So, on that point, most people in Vietnam treat their pharmacist like their GP, is what I heard you say, right? And we all know that to be true. And Vu, so you essentially supply to thousands and thousands of GPs that are dressed up as pharmacists. Should they be paid for their labor?
Yes, thank you for the question. I strongly believe that our physicians in Vietnam are getting incentivized the wrong way. They're not getting incentivized for their labor, but they had to find other ways to get us an income. And they had to sell cheaper generic drug for higher margin, for example. And I think that's something that needs to be changed in order for us to have to put patient first. Physicians need to be incentivized the correct way. Pharmacists need to be paid for their labor, and doctors need to be paid to check on patients.
Thank you. And talking about the first panelist, we talked about a war on talent. And Raghu, have you attracted staff from the public sector? And it's what's your view on doctor pay and essentially is that a big attractant for you to get talent?
Yeah, I don't see it as a brain drain. I see it as a redistribution of brain power. And the reality is that physicians are not going to be able to dedicate all of their time to just one aspect of the industry. So a lot of our physicians, they actually would work both within the public and private sector, and we're proud of that. And just by having a flexible model of care, we don't need full-time physicians at all hours of the day. Also, most physicians that do, let's say, leave that public sector or hospital setting, it's really for consultative theaters of care rather than procedural theaters of care, which are better supported by the public or inpatient sector. So for us, we don't see it again as the public sector is losing talent. I think that talent is basically being redistributed across what I think is also a very important stakeholder, which is the private sector. That's also another way, I think, to develop the primary and community-based models of care that were discussed in the previous panel.
Thank you. I think we have to agree that the future of Vietnam healthcare, you can't ignore the public system. I'd like to maybe hear from all of you. What's one element of how the private sector can collaborate with the public sector? Ladies first.
Well, actually, I think for me, the term public and private partnership for healthcare, I think it was on the radar, I think, more than 5 years. But I rarely see some progress on that part. Because first of all, as you just heard from the previous panelists, right? The patient pool is not really segmented. People want to get care urgently and also with high quality. So in case that one really do a better job, automatically you are killing also the patient flow, or you reduce the patient flow from the other one. So for me, I think first of all, let's say it's best for patient that if everyone want to do the best for the patient and they do compete, they develop themselves. And then also if, as you're saying, the doctor have a better pay with their dedicated time in private, it's also good for them because they also get a better pay. So all in all, the partnership here is more about how we calibrate the resource. Because I believe that the reason the doctor have actually currently their gaze still at the public for some reason. And for example, the hospital, they have also a lot of exchange and experience that currently the private sector cannot replace. And it grow up our doctor as well. So that's why there are reason to maintain, let's say, a fair competition in my way.
Thank you. Raghu, public-private partnerships.
So we actually have a partnership with the University of Medicine and Pharmacy where we partnered with their family medicine department and serve as one of their training centers. We also have a lot of faculty from the university that supports our care delivery efforts. And we also feel that there's opportunities for us to also sponsor research. I think, I'd like to better understand, quite frankly, some of the challenges in terms of training the future generation of physicians within the country, because I think that if there's ways that we can support that, either as a training facility, as a resource partner, or just in any other way, I think we'd be very open to those types of exchanges with the public sector.
Thank you. And before you comment, I'm going to maybe invite more questions from the audience this time, so please get your hands ready, and we'll come to you after Vu's comment, and where you see the role of the public sector vis-a-vis the private sector.
Well, I think a lot of what she just said, private sector can reduce the load of the public sector. And I want to tell an example. And what we try to solve is the patient, because they need a specific drug that only the hospital have, they had to come back. And that's why if the pharmacy in the rural area has accessibility to that drug, and the patient can buy them affordably, then pharmacy can actually reduce a lot of the refill of that drug. Yeah.
I think that's a really important note, is the private sector can help redistribute the demand load of a system that is already crippling under demand. So thank you.
Yeah, actually, our public system have that. We had Jam Ita was everywhere. I think we had 6,000 of them. But they're not provide a service that's good enough for the patient to come back. And the private can also have to increase the quality of those already in place public system.
I think it's 10,000 actually.
Sorry, my statistics answer wrong.